Hi, we are Krystyna, Larsen, and Joseph Isaac. We will be talking about our research project, Treating Dental Anxiety, Nitrous Oxide versus Desensitizing Techniques. Dental fear is one of the most common issues dental clinicians face on a regular basis. Fecco and Zanet, 2017, state that dental fear can be considered a universal phenomenon with different cultural features. Furthermore, Beaton et al. 2014 explains that dental anxiety or dental fear is estimated to affect approximately 36% of the population, with a further 12% suffering from extreme dental fear. And it has been cited as the fifth most common cause of anxiety by Apukatan, 2016.
Nitrous oxide use is one common method of intervention, and new research is being done on psychological techniques to reduce the symptoms of dental anxiety. This research project was done to answer the following PICO question. For patients with dental anxiety, desensitizing techniques, when compared to nitrous, are equally effective in reducing anxiety symptoms in the dental setting. This was done through gathering research on nitrous oxide use and those interventions that are more behavioral in nature, using specific mesh terms pertaining to dental anxiety and dental fear. The results of this research indicate that desensitizing techniques are an equally, if not more, effective method of treating patients with dental anxiety. Desensitizing techniques lead to long-lasting effects, whereas nitrous oxide use is only effective in managing symptoms during the appointment.
We conducted our research using the LW Tech Library Learning Commons, ProQuest, and PubMed as our databases of choice. To find relevant research, we used mesh terms including dental anxiety, nitrous, desensitization, and behavior therapy. The terms dental fear and dental anxiety are used interchangeably in our research. Studies on the harmful effects of nitrous were omitted. We further filtered the results to only include peer-reviewed articles for the purposes of specificity and credibility. We then isolated those articles that were focused on the efficacy of either intervention. Qualitative data was a large part of the data collected, as studies on nitrous oxide were limited and largely qualitative in nature.
Cianetti et al. 2017 advises that it is important to identify the stimuli contributing to the patient's dental anxiety so that we can help create prevention programs to reduce dental fear occurrence. Armfield et al. 2007 warns that dental anxiety affects the pursuit of dental care, thus leading to longer time between visits, overall poorer self-rated health, and patients seeking treatment for the relief of symptoms. These factors combine to create a vicious cycle of poor and declining oral health. Nurmo 2018 states that it is very important for clinicians to properly and accurately estimate the pain of their patients to affect dental anxiety over time. Apukatan 2016 explains that patients with anxiety will have an exaggerated memory of their pain, experiencing more pain that is longer lasting. Nitrous oxide is very commonly used to manage dental anxiety. Gupta et al. 2019 states that nitrous has been shown to lower post-operative anxiety and perceived pain.
In two case studies, Morse and Cohen, 1983, successfully used meditation hypnosis to deal with dental fear that is specifically tied to needles and dental injections. In 2001, Ventus et al. Showed humor can be used as a desensitization tool as it exhibits benefits to the body's response to stress. Kankaala et al. 2019 found cognitive behavioral therapy, CBT, to be most successful on its own when compared to being used with nitrous oxide in a study of participants of varying ages above 2 years old. The study included medically or mentally compromised individuals as well as participants with disabilities. Bucks et al. 2019 conducted a study on 84 children with dental anxiety using a self-guided cognitive behavioral therapy resource titled Your Teeth, You Are in Control. They were given assessments before and after to measure their level of dental anxiety. Using the self-guided resource, they observed a decrease in the anxiety score of 78 patients. There are multiple studies that demonstrate the effectiveness of cognitive behavioral therapy in treating dental fear, but very few dentists recognize it as a way to treat dental anxiety. Furthermore, there is a disparity between male and female doctors in what they find to be effective dental anxiety treatment methods, according to Williams et al. 2016.
Our design was successful in exploring the management of patients with dental anxiety at an introductory level. There's limited research that directly compares nitrous oxide to the desensitizing techniques. And this research is designed for dental professionals to aid them in managing patients with dental anxiety and the symptoms they experience. Desensitizing techniques are slowly becoming more popular in managing and treating dental anxiety. Dental professionals should be educated on the value and use of these effectual interventions through emphasis on the effectiveness of desensitizing techniques and instruction on the implementation of these techniques into their practice. Healthcare is highly variable, so it is important for clinicians to stay up to date on evidence-based techniques so that they can help their patients feel more comfortable. Thank you.